Hello, this is Dr. Janice Huntingford again, and today's installment is called Out of the Box Rehabilitation. This is about unusual cases, things that work and things that don't. And these are some things that I have found that have worked for me and I hope will work for you. And then there are some things that don't seem to work for anything. And we'll talk a little bit about those because they can be very frustrating. So the first thing that we're going to talk about is vestibular disease. And vestibular disease is something that people do not often think about using rehabilitation for. There are two types of vestibular disease that we see. We see central and we also see peripheral. Central is often a brain tumor, but it can be other things, granulomatous meningoencephalitis, a few other inflammatory diseases, but generally the central vestibular issues are totally bad news. Peripheral vestibular, that's the one thing that we tend to see as something called geriatric vestibular disease. And I field a number of phone calls from clients and also from veterinarians about, is there anything that I can do with these dogs who have peripheral geriatric vestibular disease? And first of all, veterinarians are very frustrated because they would like to have their clients go to a neurologist to determine if it is a central vestibular issue or a peripheral one. But I can usually tell, and I think you will be able to tell from now on as well. In general, not 100% of the time, but in general, you can differentiate peripheral from central vestibular disease by proprioceptive deficits. If the animal has proprioceptive deficits, then that tends to be an indication of central vestibular disease, which has a poor prognosis, as opposed to the geriatric peripheral vestibular disease, which has a good prognosis. So let's look a little bit at the causes of vestibular disease. The peripheral form is a lot more common than the central form, and the causes of that tend to be chronic and recurrent inner and middle ear infections, head trauma, stroke, tumors, polyps, meningoencephalitis, hypothyroidism, things like that. It can be caused by an infection, a congenital problem, or it could just be idiopathic. A congenital defect could be. With older dogs, of course, we're looking at often brain tumors, and causes of the central vestibular disease, which is the less common form, as I said, brain tumors, inflammatory diseases, infections, trauma, bleeding in the brain, loss of blood flow, and cancer. So there's many, many different causes. And here are the clinical signs we see with vestibular disease. We're going to see nystagmus, we're going to see head tilt, we're going to see ataxia, nausea, and vomiting. Now there can be a difference in the nystagmus between central and peripheral. You can get rotary nystagmus with your central, but you don't always. But here's the thing, treatment for vestibular disease, there is not a lot of treatment in the conventional realm for vestibular disease, except anti-nausea drugs and supportive treatment where they maybe are going to hand feed the dog. Perhaps, if it's really not eating or drinking, they're going to put the dog on intravenous fluids, that sort of stuff. But they're really just hoping that it's going to get better. And the big issue is that with these peripheral vestibular diseases, they just need some time, and with time, the nervous system will repair itself. And there are some things that we can do as rehabilitation professionals that will help it to happen faster, because if it doesn't happen fast enough, the clients are going to euthanize the pet. A client looking at a dog who's had a vestibular incident thinks immediately that the dog has had a stroke and it needs to be put to sleep. I would say I spend more time convincing people that their dog might get better from this than not. And there is something that's truly called vestibular rehabilitation. And this started with people. And there are little otoliths in our inner ear. And if one of the otoliths gets out of place, then with people they're going to get terrible vertigo, and they have some vestibular signs. And there are physical therapists, human physical therapists, who are trained to deal with vestibular disease in people. And some of them have applied these techniques to dogs. So what are the aims and goals for our vestibular rehab? So initially, we want to provide support, supportive management of the posture of the dog and in transferring from one position to another. We want to help increase the sensation and awareness of body position, because these dogs are often rolling and rolling and they don't know where they are and their heads are spinning. And I don't know if you've ever had vertigo, but I have on occasion, and it is not fun. But the other thing we want to do is maintain soft tissue flexibility. Remember the story that I had told you about the dog that couldn't move his back legs, and eventually when they fixed the problem, he couldn't move his back legs because he'd had a lot of muscle contracture. So if we do nothing else, we need to make sure that the animal is in a safe place. We need to make sure that the joints are moving. Then we need to work on some proprioception. And after about a week or so, as the dog continues to improve, we're going to have to work on core stability, because we're assuming these are geriatrics, and I don't know that core stability is going to prevent any further vestibular problems, but it's going to help the dog in his regular life. And we're going to further work on proprioception. We're going to raise the awareness of the body position and posture. We're going to advance functional transfers of weight, okay? And we're going to facilitate supportive gait patterns. So when we talk about facilitating supportive gait patterns, we're talking about doing assisted standing, assisted sitting, and perhaps assisted walking with a harness, getting the dog to move, maybe using a TheraBand, because some of these dogs become very, very disabled. So once we have good recovery, then there's still further goals that we have. We have to continue to strengthen the core muscles. We want to enhance the gait pattern, including the pace of the gait. And when I talk about that, what I would like would be for the dog to not to walk at a normal pace, so not slow, but also if we could get it to not pace like the horses do. The standard bred horses, when they run, they're not trotting. A lot of them are pacing. And pacing is, of course, you're moving your right front and your right hind leg at the same time, as opposed to the crossways diagonal. A lot of dogs with neurological disease are going to pace. And one of the things we can do, especially with these vestibular dogs, is try to retrain it out of them. We want to enhance exercise tolerance and cardiovascular fitness and return to normal function. So those are the goals that we have. Now, not all of our patients are going to be that way, but many of these are old geriatrics that are probably sarcopenic already, and so we need to look at using some of these rehabilitation techniques for them. So I have here vestibular rehabilitation. This often works, and it often does work, but that said, I have had some patients where nothing worked very well. The specific rehabilitation moves that are aimed to replace the out-of-place otoliths in the inner ear involve putting the dog, really you end up rolling it in a very specific manner, and this is not really the spot to talk about it. I'm hoping in lab to demonstrate for you how you do vestibular rehabilitation, and we can practice doing some of that. But I can tell you I've done it a number of times, and sometimes it works immediately, and the dogs are a lot better. And sometimes it doesn't work at all. So my thought is that with this particular weird case, that sometimes these otoliths are out of place and that's what's causing the issue. And sometimes there's obviously something else and we don't know what it is, but it's obviously not the otoliths. So there's 4 little points here for you that show that any dog who's having a vestibular episode can benefit from these 4 basic rehabilitation principles. Stand the dog up every hour. Every hour or so that the Golgi tendon organs and the mechanoreceptors can give the CNS the correct input. It helps the dog to remember which way is up. So even if the head is spinning and the dog is wanting to roll, you have to try to get the dog, stabilize the head, stand him. And someone can hold the dog in that standing position for 3 to 5 minutes. And that's generally what I have my technicians do when I get one of these dogs that comes in. Acupuncture can be very helpful for these dogs. And I should also say there are also herbs that I use for vestibular disease. So acupuncture and herbs can be very helpful for these dogs who have vertigo. And then you can consider hydrotherapy in the underwater treadmill. You have to put the life jacket on the dog, and you don't want to do this if they're rolling. But the water helps to support their weight, and it helps with assisted standing. So if you have a dog who is quite heavy and your staff is having a hard time holding the dog up, I usually put them in my underwater treadmill. I don't move the treadmill. I put a life jacket on the dog, and we stand there in the treadmill with the dog for 5 minutes, for 10 minutes, so that we want them to be standing and getting the input from the feet into the nervous system. And then we want to do some PNF patterns. So if we can get the dog to walk, we will. Otherwise, we're going to do PNF patterns like paw movement. We're going to scratch the dog behind its ears. We're going to do some sit to stands. All of those kinds of things that are just going to be normal motions. And so that's kind of a weird case. And many times things do not work and people don't think about doing rehabilitation with dogs that have vestibular disease. But dogs that have vestibular disease are a really good reason to do rehabilitation. And here's the timeline. As you know, I've given you more of these before, but this might be something that you want to keep and figure out, what you're doing, and it tells you how to work through these cases. We want to increase our body awareness, and as I said, PNF patterns, acupuncture, NMES, sensory techniques, and then management at home, which is huge. You need to have a discussion with the client about what kind of mobility aids do we need, what kind of flooring should we be on, do we need yoga mats, those kinds of things. After about 2 weeks, that's when we're working on our core stability, our home exercises, our NMES. We're still doing acupuncture. I find the PNF and massage are really helpful. So if you have a very compliant owner, there's very, very many things that you can get them to do. And then you can see as of 4 to 6 weeks, we're still working on that. And at that point, we're trying to retrain the dog's gait. We're getting back to what we need to do. And hopefully after 6 weeks, we just have a few residual deficits that we're working on, and we can continue to work on this as needed. So degenerative myelopathy, when we were talking about neurological rehabilitation, I had said we would talk more extensively about DM in another lecture, and it's this lecture, because this is a kind of out-of-the-box, strange things, what works, what doesn't. Degenerative myelopathy, most of us know what it is, but it's a progressive, demyelinating, non-painful spinal cord condition, and it's similar to ALS in people, Lou Gehrig's disease. Tends to be an 8 to 14-year-old onset. Our clinical signs are things like ataxia and proprioceptive deficits of one pelvic limb. It starts like that. Generally, then it progresses to both of the back legs. The clinical course is about 6 months if there's nothing else done. We have had patients who have survived up to 3 years with intensive rehabilitation and using assistive devices. Now, I think the paper that was done, that was just on physical therapy, said 6 months if you do nothing, an additional 255 days, which is about an additional year, if you do physical therapy. And yes, that's true, but depending upon how intense your therapy is, could be almost 3 years that you might get. So what causes this horrible disease? Well, it is a missense mutation in the superoxide dismutase 1, the SOD1 gene. So it's really a misfolding of the mutant at SOD1. It induces neurodegeneration by forming these insoluble aggregates. And these aggregates alter intracellular function, and they alter the enzyme substrate specificity. And what they do is they generate toxic byproducts. And these toxic byproducts result in degeneration of the white matter of the spinal cord. So the cause is really genetic. And these are the breeds that we tend to see affected: the German Shepherd dogs, the Corgis, Boxers, Chesapeake Bay Retrievers, Rhodesian Ridgeback. But it can also occur in mixed breed dogs. So there is a DNA test that is available now. It's not an expensive test, but what it does is it's going to, because it's a recessive gene, and if you have 2 alleles for it, then you're at a high risk of developing. So it's going to either give you a result where you don't have it at all, or you may have one that may be carried on one gene, so you are a carrier. Or if it is both of them, then you're at a high risk of developing DM. And I would think that if you have a double recessive on this gene and you're a German Shepherd dog who has issues with the back end, that likely that's what you have. Now, the pathologist will tell us that DM is really a post-mortem diagnosis, because you can't say that the dog has DM until you notice histologically that the spinal cord, the white matter, has degenerated. However, if you have the clinical signs of it and you have both of the genes, the likelihood is that you have DM. Now, from a conventional standpoint, regular medicine, you can diagnose DM and say, bye-bye, this disease will kill you, and there's nothing I can do. There's no drugs I can give to you. There's nothing that I can give you, at least at this point, that's going to help with degenerative myelopathy. But here's the thing. Physical therapy does help. As I said, 6 months if you don't do anything, maybe up to 3 years if you do. Now they talk about, nutrition therapy and herbals along with physical therapy, and we're going to talk mostly about physical or rehabilitation therapy and what we have to do for it and how that looks. So what we want to do is to delay the progression of the condition and to enhance the quality of life. So we need to maintain mobility and gait patterns. And this is a big one here. Prevent tightening of soft tissues such as tendons, muscles, and ligaments. Maintain muscle mass, enhancement of balance and coordination, and prevent injury that might occur as a result of the existing issues. So those are the things we need to work on. And how does this work? Well, we need to give clients advice regarding exercise modification and avoidance of fatigue. I think when we're talking about this, clients need to be aware that the dogs need to not do so much, because the more that they do, the worse the condition is. So we really want to avoid fatigue. The other thing, where possible, you want to avoid is general anesthetics. Because if the dog has degenerative myelopathy and they're given a general anesthesia, they usually will regress. So if possible, we need to avoid general anesthetic. If we're doing active and passive exercises, we need to do only so much and no more. The passive exercises aren't bad, but too much active exercise, too much stress and strain is very difficult for these dogs. Strengthening of muscles, we need to use a combination of exercises. So a combination rather of exercise, hydrotherapy, and muscle stimulation. So this is one where I'm going to do active range of motion. I'm going to do passive range of motion. And I'm even going to have the owners do NMES at home. I have a number of NMES machines in my practice, and I rent them out to people by the month. If they have a dog that needs it, we're going to do that. If I have a DM dog, I usually recommend they buy their own because they're not very expensive. They're maybe $150. And so, you know, when we rent them, I don't know how much we rent them for, but in general, most of our neurological patients only need them for a month. But if you have a DM dog, you're going to need it probably for the life of that dog. So it's a good idea to purchase one. And laser for painful muscles. I'll present an interesting paper to you in a few minutes. Now, we do use some herbals for degenerative myelopathy, and this is one of my favorites for this condition. There are others that you possibly could use, but that's one that I particularly like. So let's look at this. This is a difficult diagnosis to obtain and difficult for the owner to accept because although we do have a genetic test for this, the owners, even if the dog is positive, I mean, you can't say it is that for 100%, and most of the time the owners don't really want to think about that. And because it's a non-inflammatory axonal degeneration, and it's not painful, that makes it very difficult for the owners to look at the pet that they love and realize it has a horrible degenerative issue. So when we're helping them with some of these things we've talked about, one of the things we were talking about is laser or photobiomodulation therapy. How does that help with degenerative myelopathy? It doesn't stop the demyelination, but it does a few things for the muscles. It's going to increase your cellular respiration and the blood flow. It's going to provide analgesia to the areas of muscle that are being overworked because the other areas south of it are not working. And so it's going to slow the degeneration that's going to occur within the muscle at the cellular level. So here is an interesting paper. I'm not sure if it's through peer review or not. It was going through peer review in Frontiers, but this was, it's a retrospective analysis. So it's not a prospective study. It's not a hypothesis-driven research piece of paper. It is a retrospective analysis because it's difficult to do a prospective analysis on degenerative myelopathy. But Debbie Gross-Saunders, Debbie Gross-Taracha, got her name wrong. She is a physical therapist who is at Wizard of Paws in Connecticut, and Lisa Miller works for Companion Animal Health. And she's been helping Debbie write this paper up as using photobiomodulation combined with rehab as a therapeutic protocol for canine degenerative myelopathy. This is there's a lot of words on here. You can certainly read it yourself in your notes, but pretty much the object of this respective study was to examine the impact of adding photobiomodulation therapy to intensive rehab and whether that would decrease the progression of the clinical signs of the DM. And what actually had happened at Debbie's facility, because she has always treated DM, and she has been a big proponent of doing laser, particularly on the muscles of the thoracic and lumbar area, because she felt if those muscles were feeling better, that the dogs would be around longer and not so painful, and that would help. So she had one laser that was delivering a low dose of laser energy, and she got a new laser that was a higher dose. So she had a number of dogs that she treated with rehabilitation and with her low dose laser, and then she had another number that she treated with rehabilitation and her high dose laser. So she took this information, and it was between 2003 and 2012. They screened the patients for inclusion and exclusion criteria. They got rid of the dogs who had other things other than DM, and where possible, they looked at the final postmortem diagnosis. Now, not all the dogs had a postmortem diagnosis of DM, but it was postmortem or confirmed with the double recessive gene test. So related to all of these things, and she pretty much was doing the same rehabilitation with all of these patients, the only difference was the laser that she had used. And so she looked at the time of progression of the clinical signs of onset. So the symptoms at onset to the time of non-ambulatory paresis or paralysis and euthanasia. So she had that information. She correlated all of that information. Difference between the two, between the low-dose laser and high-dose laser, was significant. And the data showed that there was a significant difference in progression from symptoms of onset to non-ambulatory paralysis and the time of euthanasia between the two photobiomodulation dosage groups. What she saw, the physical therapy and laser had longer survival, 255 days, compared to those who didn't. And her treatment goals were, of course, to have prolonged and improved quality of life, maintain movement. And her laser therapy, she was looking at it as increasing cellular respiration rate, blood flow, analgesia, and slowing degeneration. We've talked about this already. But this was the dosage that she used for this study. So in the other low dose study, the dosage that she used was only 8 to 10 joules per centimeter squared, and but with the higher dose, she was using 15 to 20 joules per centimeter squared, and she's done it up to 30 joules per centimeter squared in the thoracic and lumbar areas. And so she was showing that this is digital thermal imaging that you're looking at here. And with the digital thermal imaging, you can see that the areas that are red are the areas that are hot. So these were muscles that were particularly painful. And so she's showing them here before and after laser therapy, photobiomodulation therapy. So you can see that obviously the dog over here, the lighter colors are cooler. So this dog had a lot of inflammation, and then that was treated, and then that was a lot cooler. So the animal was a lot more comfortable. So this is very interesting that she would find that this actually works. So the thing is, this is not a prospective study. Is it something that's worth doing? Well, I think so. It's kind of an out-of-the-box thing that nobody knows if it's really going to work. But I haven't tried it yet on any of my patients, but I'm waiting to get one. And I think I'm going to do 25 to 30 joules per centimeter squared. Now, that seems like a lot when you look at laser dosages, but if you look into the literature, you will see that when they got these devices, when they passed their FDA approval, that the doses that were used on the test animals were much higher than the doses that we are using now. Many of the doses that we are using with laser are things like 4 to 6 joules per centimeter squared, maybe 8 joules per centimeter squared. Very few people are using 25 to 30 joules per centimeter squared. But I think that I would try that with a degenerative myelopathy dog. And maybe that's just because I did a laser study on elbow arthritis where we used dosages that were much higher than the ones that are published to use. In fact, for our elbow arthritis, we were using more like 15 to 20 joules per centimeter squared, depending upon the size of the patient. So that's kind of out there, but I would certainly try that. It's not going to burn the patient, and you don't have anything to lose. So here's a lovely condition that doesn't have a lot going for it. So fibrotic myopathy can occur in a number of muscles: the semitendinosus, the gracilis, the quadriceps, the infraspinatus, the supraspinatus. I think it can occur in the semimembranosus as well, but a number of muscles. And there have been many rehabilitation therapies that have been tried, and none of them really work. So this is kind of a weird thing that doesn't work. So if you get one of these cases in and you think your laser is going to help or your acupuncture, it's not. It might slow down your fibrosis a little bit, but they always contract afterwards. There are some people who've done surgical releases on these dogs and with these affected tissues, and still they still have issues. Even if they completely resected them, they will come back with fibrous tissue, and they're not really sure why. So the clinical signs are really a non-painful mechanical lameness. So this is one of these conditions. You know, you can try anything you want pretty much on it. It doesn't seem to work. However, these are the things that have been tried. Laser, ultrasound, stretching, acupuncture, exercise therapy. Nothing has really made much improvement. And a number of my rehabilitation colleagues and I have had discussions on this and not been able to find much that really worked. But here is what the gait looks like in case you've never seen it. So this is a gracilis fibrotic myopathy. See how the dog is turning its leg in? If we were to slow it down, we would see it a lot better. But it is a very specific gait. And it does tend to be very common in German Shepherd dogs. But you can see how he's got that little hike there in the hitch in his giddy up. Up, up. It's almost like and it's very specific how that looks with the stifle. So, but here's an interesting thing. Here's a new study that came out in the CVJ, the Canadian Veterinary Journal, and this was on semitendinosus myopathy and treatment with adipose-derived stem cells in working German Shepherd police dogs. So it's an interesting thing. So what they did was they decided they would try using adipose-derived stem cells and inject them into the fibrotic areas in the semitendinosus. So this was done. They had a radiologist who did musculoskeletal ultrasound and looked at these areas and then injected those areas with the adipose-derived stem cells. Not sure which company's adipose-derived stem cells are used. I'd have to go back and look at the paper. But they didn't do multiple injections. They just said, okay, let's do one injection and see if we can get these dogs to improve. And the results pretty much showed that 7 of 11 dogs improved. So the question is, the next time we have a fibrotic myopathy, is that something that we should do? Well, maybe, but no one has actually reproduced this study yet. And I think other people have looked at using stem cells and looked at using mesenchymal stem cells, but this is pretty much a out-of-the-box treatment for this condition, of which it's that nothing seems to work for that condition. But if I had one of these, I would consider doing it. The problem is you could consider doing it and it may not work, but that certainly is a possibility. So when I talk about out-of-the-box treatments for rehabilitation, one of the things that I always talk about is the use of herbals, because herbals for many rehab practitioners are out there. You know, they're pretty used to using drugs, but I use a lot of acupuncture. I will use a lot of Chinese herbals, and I find, especially if I'm using the Chinese herbals, that they tend to work best when they're combined with acupuncture. And when I combine acupuncture, herbal medicine, food therapy, and physical therapy, I tend to get the best results. There are a lot of formulas that do exist in Chinese medicine for pain, and Obviously, if we have a pattern diagnosis, we can probably pick our herbals better than not. But there are some Western herbal formulas that I have added for the treatment of pain, for the treatment of dysfunction. So I thought I would talk a little bit about that. This dog that's here, this Dalmatian, is kind of an interesting patient. This is a 9-month-old Dalmatian that came to see me because it was stunted, and it turned out that this dog had rickets. We ran some blood work on the dog, and its calcium levels were all off. The client had been feeding it a raw diet with no supplements. It was getting ground up bone, but obviously the dog was not absorbing the bone very well because it ended up with rickets. So we put this dog onto a commercial diet that had enough calcium and phosphorus in it, and the dog did fairly well. However, the dog had diarrhea and soft stool, and I wondered, we eventually had to get it onto a gastrointestinal diet because it didn't seem to absorb anything very well. So I wonder whether the combination of this dog having an issue with and the diet that he was on, in that perhaps the bone wasn't ground fine enough for him to absorb, or he may just have not been very good at absorbing the calcium, and that might have been the problem, because the other dogs seemed to all do fine on it. But it was an unfortunate thing, and I don't generally see cases of rickets, but rickets is kind of an out-of-the-box weird thing that you might see as a rehab practitioner. And so if you have one of these dogs who is on an interesting diet like that, remember to check for the calcium phosphorus, because perhaps even though it looks like they're getting enough, perhaps they're not. The other thing to look at while we're talking about diet is that if you are using high doses of omega-3 fatty acids and you have dogs on non-commercial diets, so on raw diets or homemade diets, you will have to also look at vitamin E levels, because that's kind of a weird thing. But if the dog's on a high dose of fish oil, the vitamin E levels could be too low. So on to the herbal treatments of pain and how I use herbs in rehab. So this is an interesting herbal formula. It's one that I really like. Zhao Chai Hutong. It's a minor bupleurum combination. It's very widely used. When we talk about it in circles of Chinese medicine, we're talking about treating disturbances in the movement of yang energy, and yang energy is the motive force of blood. And so really this formula is a generator of circulation. So it does regulate the Shaoyan if you understand Chinese medicine. If you don't, you can think about using it for hip dysplasia and cranial cruciate ligament disease and degenerative joint disease and IVDD. And this is also one formula, along with Sumatsan, that I will use for degenerative myelopathy. The modified formula that I use for a lot of my rehab dogs is one that's called Benefit Hips and Knees, because it takes the Zhao Chai Hutong and adds in Jinzhao, which is Gentiana. And I have found that these dogs who are on this do extremely well. Now, there are a number of formulations that you can use. You don't have to use these. The Con herbal formula. You can get straight Zhao Chai Hutong. You can get other modifications of it. But something with the Zhao Chai Hutong, the minor bupleurum, is really, really very good for a lot of the diseases that we treat. So whether you don't feel comfortable at using herbs or not, this is one that I would certainly consider for your hip dysplasia dogs, your cranial cruciate ligament dogs, and some IVDD dogs. So here is the formula for those of you who like to see what your herbal formulas look like. So the Chai Hu, which is the bupleurum, that's in there. Wan Chin, which is the scutellaria. Banzi, which is panella. Gong Chao, which is licorice root. Shengjian, ginger. Dazao, which is the jujube, and the Renshen, which is ginseng. And I do apologize to those of you who are Chinese speakers that mine isn't very good, but I'm trying to at least get the names of the herbals relatively correct. So this is Ginger. Ginger is an interesting dog. She was diagnosed with cervical disc pain. Now, Ginger in her younger life was an agility dog, and she did love to do agility. And even though she's no longer fit here, as you can see, to do agility, her mom used to like to get her out, and she would throw the ball for her. And despite her weight, she was a fairly active dog. But Ginger came up with episodes of screaming. She was unable to go upstairs. She didn't have a fever, but she had a very painful neck. So she was walking with her head down, low head carriage, really couldn't move her head from side to side. The owner cage rested her, and she had a harness instead of a collar. She was put on meloxicam and gabapentin, and that wasn't working very well. So she was referred to me to do some acupuncture with her. So she did come in, and we did some acupuncture and some electroacupuncture. We used local points, and we also used distal points. But and I did a couple of treatments with her, and then after I'd done a couple of treatments on it, she wasn't really where I wanted her to be. Then I added the Chai Ji Jie Shin Tong, and add a teaspoon twice a day, and that made a huge difference for this dog. So if I'm treating another dog with cervical disc pain, I certainly would consider using this formula. And Chai Ji Jie Tong is another blue plurum formula that has the addition of kudzu in it, and the medical implications for it, if you're looking at the Chinese, is it's for Shaoyan disharmony. That's what the blue plurum's for, and sudden wind invasion that obstructs the normal flow of blood and qi. And this has angelica in it, notopaterum, platycondon, and the Western indications for it are IVDD, acute neck and back pain, meningitis, and spinal cord tumors. Now, I have used this in some dogs with meningitis with some success, not 100%, but I do find that for cases like Ginger, there she is, that I found that this does work very, very well for our cervical disc pain. And here is the formula. As you can see, it still has the chai hu, and then this is the pluraria root, and of course the baizi, which is the angelica, and then huangqin, which is the scutellaria, and the bai xiaoyao, which is our white peony root, and of course we have our harmonizer here with our licorice and our ginger. So here is another formula that I do use, Duho Jisheng Tang, which is it's pubescent angelica and loranthus. And from a Chinese perspective, it's an invigorator of blood and expels wind, cold, and damp. And I'm using this for liver blood deficiency, qi deficiency, because it does increase the peripheral circulation, particularly to muscles, discs, ligaments, spinal cord, and nerves. So this sounds like a formula that all rehab professionals should use. But this is a great formula for these guys, our little dachshunds. And it's good for both upper and lower motor neuron disorders, geriatrics, but it is the dachshund formula. So pain from DJD, back issues, hind limb lameness, muscle spasm, and neck pain are all treated with this formula. And we've seen Mika before, the Wonder Dachshund, who presented 8 weeks post-IVDD that left her paralyzed. She had no surgery and no advanced imaging, and she sat in somebody else's kennel for a while and eventually came to see me. And she came in on meloxicam and gabapentin, which made no real improvement except she wasn't painful. And we did acupuncture and electroacupuncture, underwater treadmill, PNF patterning, and we added Doc's formula. And when we started doing all of these things and adding Doc's formula, which is the Jingtang version of the Duhu formula, that made a huge difference with our friend Mika. And I think we've seen her before, but here she is recovering. There she's going, she's walking. So they were pretty happy with this, but I really like this particular formula for dachshunds. Here we are. She's trying to walk, pinching her tail, getting her to move along. And this is another dachshund with IVDD, but this dog, this is Petey May. Petey May had more yin signs, so I used Digupisan, which is I used Digupisan, a derivative of the Duho Jishengtang, and this is Petey May. So that's another dachshund formula that I would consider using. So here's our Duhu Jishengtang formula. You can see exactly what's in this. Oops. So that is our Duho formula. And then the Dahu Lodan formula is used for acute IVD and disc protrusion. It is a very strong formula. And it has, in the classical formula, it has aconite in it. The modern version is a lot less toxic. And the one that I use from Jingtang is called Double P. And it's also major invigorates the collaterals is the classical term for it. And I use Double P on this dachshund. So Yi Rengtang, which is koi formula, is another one that I have used in my patients. And these are the Chinese medical indications: wind, cold, damp, invasion, qi deficiency, blood deficiency, and blood stasis. So when we have blood stasis that as the underlying deficiency, and I need to drain the damp, I'm going to use koi formula. So I do use this from a Western perspective. Again, it's going to boost the circulation and resolve chronic inflammation and pain. It also sensitizes the body to insulin for another interesting thing, and it's going to help decrease your oxidative stress and scavenge free radicals. So I like this one for polyarthritis, osteochondritis dissecans, and I have used a lot of it in chronic elbow osteoarthritis. So my elbow osteoarthritis dogs are on this, most of them, depending upon the pattern, of course, but I use it for that, and also my large breed dogs with severe back pain. This is what's in this formula, Tractyloides and Angelica. And this is one of my patients. This is Kaylee. And Kaylee had really bad back pain, and she was definitely a koi formula girl. So there's 3 other important formulae that I will use. Shentang Zuyitang, which is body sore, and Cordalis and Angelica tend to be prominent in a lot of these Chinese pain formulas, and they're used for general soreness and pain in joints. And the other 2 that I use are Sanrengtang and Sumutsan. Sanrengtang really for lumbosacral disease, and Sumutsan for degenerative myelopathy and damp heat obstructing the spleen, but lumbosacral pain and DM. And then we're going to talk just a tiny bit about Western herbs for pain. I'm often asked about using Boswellia in my patients, and that is one that we can use. Turmeric is another, With turmeric, you do have to be very careful about what you're using because the spice is generally not very bioavailable. So people are always wanting to use this, and they come in and ask me about this all the time. And I will use theracumin, and there's a few other bioactive sources of turmeric, but in general, just using the herb, the spice doesn't work very well. The herb I'm usually asked about more than anything else, however, is cannabis sativa. And so that is the hemp plant or the marijuana plant. The stems and stalks are used for rope. It has been a source of fiber and feed and oils and medicines and intoxicants for a number of years. The roots, leaves, and flowers tend to be the medicinal part and are used for ritual use. So the background of the cannabis plant is that there are 421 separate compounds in there, and the one that we're particularly interested in is CBD. That tends to be the non-psychotropic one. That's kind of the major player in hemp, although there is some thought that really the whole plant is probably better than just a CBD isolate, even though the CBD does tend to be the most medically active component. So the real question is there a role for pure CBD extract? Well, maybe. So the endocannabinoid system itself is found in all vertebrates, and it has a few components. It has cannabinoid receptors, endocannabinoids, which are the ones that activate the receptors, and then these enzymes that break it down. But there's a lot of non-CB receptor activity, cannabinoids, terpenoids, and many of these things are working in that way, modulating calcium and inhibiting glycine. So there's a lot of non-CB receptor activity going on there. But here's what happens. These are all, there's a lot of stuff going on this slide, but these are all of the things that CBD itself is doing. So it tends to be, I like to look at this and not so at this side and not so much at this side. That tells us all the science there, and it inhibits LOX and COX. But anti-nociception, anti-inflammatory, anti-hyperalgesic, anti-inflammatory, anti-tumor. So it has a lot of use. And a lot of people are wanting to use this on their rehabilitation patients. And it works sometimes, and sometimes it doesn't. But the thought is that the terpenoids that are in the full spectrum, this is the stuff that gives it its nice smell. That's what is in the terpenoids. And they tend to act synergistically with the phytocannabinoids. So people are using this for pain and inflammation, cancer, anxiety, epilepsy, you name it. The clinical applications, and people want to use this for degenerative myelopathy. Maybe it works somewhat. It's hard to know. But they're using it a lot for pain and epilepsy and anxiety. So those are the clinical applications that we see, which is why a lot of my patients, people want to put it on. And we're actually running a CBD trial, not the first one. The toxicity with the cannabinoids tends to be with the THC, and the real issue with CBD is getting pure stuff. And a lot of the stuff that's out there that says it's CBD has THC in it. Dogs are very sensitive to THC. But there was a trial that was done at Cornell by Dr. Laurie Jo Gamble, Dr. Joe Wachschlag. They did an osteoarthritis trial, 16 dogs that had chronic pain. Some of them were on NSAIDs, some were not. It was a double crossover study. They excluded the dogs that they shouldn't have. They checked them out with the Hudson and CBP scores, the Canine Brief Pain Index. As far as safety goes, they only found an elevation in the alk-phos. The CBD is an inhibitor of CB1 receptor, so there was no psychotropic effects. But what they did find was that it did work. And I'm sorry, I went past that. But this was the dose that they got, and they were perceived to be more comfortable and active than when receiving a comparable placebo. So if you're wanting to use CBD in your patients, get a good source. Get a good source. And use 2 mg per kg. And I just wanted to thank Dr. Laura Jo Gamble and Dr. Joe Wachschlag for their slides regarding CBD. And this brings us to an end of our out-of-the-box information on rehabilitation. And if you have any questions regarding this or any other, please be sure to post your questions in the appropriate spot or send me an email.